हाय, मेरा नाम आशुतोष अग्निहोत्री है। मेरी एज 42 ईयर्स है। मैं आगरा को बिलोंग करता हूँ। मैं सत्या सारस्वत भैया के कांटेक्ट में 2014 में आया, जब मेरी हेयर थिनिंग स्टार्ट हुई थी फर्स्ट 2014 में। तो 2014 में मैंने भैया के थ्रू अपना हेयर ट्रांसप्लांट कराया था, जिसके रिज़ल्ट्स बहुत अच्छे थे। और भैया ने मेरे को डीपली सारी चीज़ें समझाई थी कि हेयर लॉस कम से कम 3 स्टेजेस में जाता है, तो 3 सिटिंग आपको करानी पड़ेंगी। लेकिन एट दैट टाइम मेरे को रिक्वायरमेंट सिर्फ 1 सिटिंग की थी, वो मैंने पहली बार में 2014 में कराई थी। उसके रिज़ल्ट्स बहुत अच्छे आए थे। फिर 2019 में मैंने सेकंड अपनी सिटिंग कराई थी। 2019 में भी रिज़ल्ट्स बहुत अच्छे आए थे। अभी आप देख सकते हैं मेरे ग्रोथ जो है। अभी मेरी थर्ड और फाइनल सिटिंग है 2024 में। और सेम मैं सत्या भैया के कॉन्टैक्ट में करा रहा हूँ थर्ड ये, क्योंकि डॉक्टर सत्या का जो बिहेवियर है और जो प्रोसीजर है वो सारी चीज़ें बड़ी फ्रेंडली हैं। सारी चीज़ें एक्सप्लेन करते हैं ठीक से, कोई भी हिडन चीज़ नहीं है, सारी चीज़ें बताई जाती हैं। जितनी टीम है बहुत कोऑपरेटिव है और रिज़ल्ट्स बहुत अच्छे होते हैं। डीप नॉलेज है भैया को, क्योंकि खुद गोल्ड मेडलिस्ट हैं, प्लास्टिक सर्जन हैं और ख़ुद से सारी चीज़ें करते हैं, किसी दूसरे के ऊपर डिपेंड नहीं करते हैं। और प्रोसीजर के बाद में ऐसी कोई प्रॉब्लम आती नहीं है, सब चीज़ें नॉर्मल होती हैं। और थोड़ा सा लंबा प्रोसेस है, उसके लिए आपको प्रिपेयर रहना पड़ता है। बाकी रिज़ल्ट्स आप देख ही सकते हैं। अभी जो मेरे हैं बहुत ज़्यादा नीडेड नहीं है, लेकिन मैं फिर भी करा रहा हूँ अभी, क्योंकि प्रिकॉशन लेना ज़्यादा ठीक है। इसलिए मैं भैया के पास अभी फिर कांटेक्ट में आया हूँ। भैया को मैं भैया इसलिए बोल रहा हूँ डॉक्टर सत्या सारस्वत जी को, क्योंकि मेरा एक फ्रेंड है, वो भैया के रिलेशन में आता है, तो उसके थ्रू मेरे को पता चला था भैया के बारे में। तो क्लिनिक पे ही आके आगरा वाले जो हॉस्पिटल है सारस्वत हॉस्पिटल, यहीं पे आके मैंने तीनों अपनी सिटिंग्स कराई हैं। थर्ड वाली अब कराऊंगा, जो कि आज शेड्यूल्ड है। फिर देखते हैं, लेट्स सी के कितना अच्छा रिजल्ट आता है। होपफुली अच्छा ही आएगा।
So you just listened to Mr. Ashutosh's testimonial about his procedures, his planning. He first presented to us in 2014 when he had a recession of the hairline, and at that time he was suffering from grade 2 Norwood male pattern baldness. A very important point you have to understand is that initially you may be a grade 1, grade 2, grade 3, and slowly over a period of years and sometimes decade, your baldness can progress and the grades may increase from grade 1 to grade 7. And if you try to undergo a hair transplant very early, say 20, 21, 22 years of age, and you try to lower down your hairline, and if you land up into a grade 6, grade 5 kind of baldness, then you may not have lot of grafts to address the areas in the mid scalp and the crown. So it is very crucial for a hair transplant doctor to plan out your surgery at the time of your initial presentation, and he should be asking you about your family history. They should be able to identify the kind of pattern hair loss you are having and what is going to be the future in your case. Every doctor should have a master plan or a future plan, how he is going to distribute the number of grafts, how is he going to judiciously use the number of grafts they are available in the donor site, because this source of hairs or the follicular units of grafts at the donor site is limited. It is not unlimited, because once we take out the graft from the bag and we transplant them into the bald or the recipient area, that amount of grafts will decrease from the donor site. Sometimes patient come and ask us that, doctor, when you take out the graft, those hairs will grow. Is it right? That's right, that they will grow. So no, friends, when we take out the graft from the bag, those grafts are gone forever. And if you go for an early hair transplant and lower down your hairline at an early age, this can lead to paucity or scarcity of the graft when you may need them after a couple of years or even a decade. So this is a very crucial part of planning of the procedure. Please like this video, and we will keep on discussing this particular case and its very important points about the medicines. So in the first sitting in 2014, we did a hairline restoration when there was a minimal recession of the hairline and he was having around grade 2 male pattern baldness. Then he presented to us in 2019 February, which is around 5 years from now, and around 5 years from the first surgery. That time we addressed his mid-scalp area baldness, and he had a lot of thinning and loss of hair in the mid-scalp area. We again did the trichoscopy and we addressed that by around 2000 graft in the mid-scalp area. And as you can see in these pictures, before the second transplant and current pictures, in 5 years, he has been maintaining those results because he has been consistent with the medicines like minoxidil and finasteride which we prescribed to him. Also, he was very regular in follow-up. If he could not come, then he was having online consultations and casual talk about his hair loss problem. So it is very crucial for you to keep your doctor in loop at all times. Even during COVID times, we were having regular connections and regular calls with our patients, including this patient. And Mr. Ashutosh preserved the transplanted hair in the front and the mid scalp. And now, over a period of time, he started having baldness in the crown area, in the back side of the mid scalp as well as the crown area. And now he presented to us in 2024 to address that issue. It is the faith and the trust of such patients who keep on following our advices, are in regular touch with us and asking our feedback about their problem, that we also go out an extra mile. We are also available for them. We are also advising them if they are having any problems. We are there for them all around the year, and we have a dedicated team of our staff also who are in touch with our old post-operative patients. So after 10 years of his first procedure and 5 years of his second procedure, we planned out his third procedure, which people may need as their baldness progresses. Request you to subscribe to our channel for such useful, informative videos which can help you in understanding the hair loss problem and trying to combat those problems. Now in the third sitting, again, as our protocol is, we did his trichoscopy. We found out his remaining number of grafts which were available in his donor site. Then we fixed a date for him. We started with the procedure by giving the local anesthesia in a ring fashion using the vibration and cool tip devices. So with the vibration device and a cool tip device, the pain you get when you are injecting a local anesthesia and saline for the tumescence, it is very, very minimal because vibration and cold sensation is carried to the brain, thereby decreasing the minimum pinprick sensation which is due to the local anesthesia. So after this, we did the slit making procedure and we made the required number of slits in a sort of an irregular fashion so that it doesn't look like a linear pattern. And then after making the slits, we changed his position and we extracted the graft. In these pictures, you can see even after 2 sittings of hair transplant, still there were a lot of roots available in the donor side. And this is because our transaction rates are really very, very low, very minimal, less than 1% or so. And this preserves a lot of hairs in the donor side for future use. And this is because we use a very low rotation per minute speed machines to extract the graft, and they have a low torque also. This way the damage to the roots or the transaction rate is very, very less. And that's why we can go and keep on taking out the grafts. Also, you must know that around 15% of the hairs at any point of time are in the sleeping phase, thereby making themselves available. Those roots, when they come out, they are also available for extraction. And then after that, we did the insertion part. Patient also came out for the routine follow-ups like shampooing and all that. And currently it's just a couple of weeks since we did his procedure. We are also waiting out for his results, and we will be definitely making a video later on about his results. If you are having such a problem and you want to reach out to us or you want to take our help in planning your hair transplant, you can either comment in the comment section below with your contact details, or you can call us or WhatsApp us at the numbers mentioned on the screen below, and we will try to reach out to you. Our team will try to reach out to you so that we can help you out. You can share this video with your friends to know about the long-term impact of the baldness and the importance of medical treatment in maintaining those results. To know the cost of hair transplant, please click the video on the left, and to see result of one of our hair transplant patient, please click the video on the right. Thank you very much.